can see surface marking has been done here. This is the patella, this is its lower pole, this is ligamentum patelli, this is tibial tuberosity. This is the margin of tibia medially and this is the laterally. Now this is the center of the knee joint and this is the lateral one. In between 1 centimeter lateral to the ligamentum patelli and 1 centimeter above to the tibial margin, and at the lower pole of patella you will see a soft point. This is the soft point from where we will inject. 3 ml solution of hyaluronic acid. It is a pre-filled syringe and a wide bore needle is attached with. So now we are going to inject, as I told, through this soft point. We will go at the angle of 45, not like this, not like this. At the angle of 45, go straight into joint and then aspirate it, if blood, withdraw it and inject it slowly. And keep in mind, it may cause sometimes, very rarely, an anaphylactic shock, so necessary preparation should be done. Inject it slowly into knee joint, as I am doing here. So the injection is complete, and after injection keep a gauze over here, and after injection apply a plaster over here.